Good evening, folks. I want to thank you for joining us for tonight's webinar on food intolerance and chronic disease with Dr. David Blyweiss. As a reminder, tonight's webinar is going to be a preview of the Gut-Brain Symposium held on August 16th through 17th, 2013 at the JW Marriott at LA Live in Los Angeles. The Gut-Brain Symposium will provide the latest information regarding the links between food and disease manifestations. The scope of the presentations will include a focus on GI and neurological disorders, but will extend to other organ systems, including the cardiovascular system and others that may be affected by food and gut-associated immunological triggers, such as metabolic syndrome and obesity. Some of the key speakers that will be attending are William Davis, MD, Alicio Fasano, David Perlmutter, and Dr. Blyweiss. Dr. Blyweiss has been practicing medicine for countless years. He's been a functional medicine doctor since the 1990s. He teaches for the University of Miami Miller School of Medicine and is Chief Medical Officer of Cell Science Systems. Before I give the mic to Dr. Blyweiss, I want to send a quick reminder to everybody that if you have any questions throughout the webinar, please write them in the question box and we'll address them at the end of the webinar. So, Dr. Blyweiss, the floor is yours.
Thank you, Dan. What we're going to talk about tonight is the idea of food intolerance and chronic disease, something that we've seen now for over 50 or 60 years. Has been the increase in the chronic degenerative diseases, autoimmune diseases, that mirrored the change in our food supply as well as some changes in our environment. What we're finding is that, and now we see that the AMA is making obesity a disease. Unfortunately, some people may see that as it's not my fault, it's a disease, and I think we have to work towards fixing something like that. Americans have more food to eat than anybody else on the planet, and we have more diets to keep us from eating that food. When we talk about the gut and the brain and autoimmune disease, we have to remember that our GI tract, our gut, sees more foreign protein antigen in one day than our systemic immune system sees in our entire lifetime. That's because we eat about 50 tons of food in our lifetime, obviously some of us more than others, but we eat quite a bit of food, and the GI tract does have to sort out self from other, and it has to be rather good at that on a daily basis. The example that we like to use is the Pima Indian study, where you have a group of, a homogeneous group of people who have remained on in a certain geographic area in their lifestyle, eating the foods they're eating for thousands of years, and have maintained in all that time normal body weight, normal blood sugars, normal intensive ranges, minimal to no autoimmune diseases, minimal to no chronic degenerative diseases. When they moved and when we brought Western diets into them, those that ate the standard American diet, within a very short period of time, developed two of the main chronic degenerative diseases that we see today, that we have as diseases, basically diabetes, obesity, diabetes, as well as the metabolic syndrome. So what's going on? Again, it's never one thing. It's not just that we're eating genetically modified food. It's not just that we are eating fruits and vegetables that have minimal nutrition in them, since we're not putting it back into the ground. And actually, this was an urgent bill that was put to the Senate. It was Senate Bill 236, which basically said it was an emergency situation that the food combines needed to put back into the soil that which they had been taking out for years. And that was 1936. And nothing happened since then. So you can imagine how minimally nutritional some of our food is. Also, at the same time, our level of herbicides and pesticides have gone massively up. We then began to change our foods. Granted that Norman Borlaug saved India and Pakistan by developing his dwarf wheat so that the amber wave of grain did not flop over during a monsoon, but that dwarf wheat that we now call wheat that we eat has more genes than our standard wheat that we've had, has I think triple the gluten, and it's not exactly wheat, and it goes along with the food sensitivities to it, as well as the level of celiac disease since the 1950s and 60s, since the change in wheat. So what's going on? And how do we know what food is good and what food is bad for us? Well, we know that the foods we eat that are causing chronic illnesses may be secondary to our allergenicity to them, our intolerance to them, our sensitivity to them, if we are intolerant to them. And while people will say, well, the broccoli is good for me, the kale is good for me, most of us, on average, will have negative reactions, whether it's a fatigue issue, headaches, joint pain, the general sluggishness, obesity. We will react negatively to anywhere from 3 to 20 different foods. Now, the differences are that when you have an autoimmune disease, like celiac disease, which is truly one of the few diseases where we know what the trigger is and we know what the cure is, in other words, not having gluten, the idea that we knew how it worked was beyond us until about 2009, when Alessio Fasano, while he was at the University of Maryland, now he's at Harvard, with the Celiac Foundation he runs, found that even a thumbnail size of gluten would trigger the release of the protein zonulin, which would cause a loosening of the tight junctions that was holding the intestinal lining together. And hopefully, while it was still tight, there would be no partially digested food antigen or food particles, no opportunistic bacteria or lipopolysaccharides coming off the bacteria that would be able to get through the cell wall, the intestinal wall, and into the general bloodstream, where the body would then recognize it as other and do what it's supposed to do, which is attack it. We're looking at his use of the celiac disease model as the model for general autoimmune disease, where you have a GI tract that is no longer perfect in its non-leakiness, where you have an intestinal dysbiosis. You may have abnormal bacteria or yeast or viruses. You may have foods that you become sensitized to or have genetic predispositions to. And wherever that partially digested protein goes, or wherever that bacteria goes, or that protein coat goes, wherever the body attacks it, that may be where we give a diagnosis of an autoimmune disease. If it's in your joints, we may call it a rheumatoid arthritis. If it crosses the blood-brain barrier and attacks the central nervous system, we'll say if it's gluten, and we call that multiple sclerosis. And if that turns out to be true, then that means that we are naming our autoimmune diseases by geographical location, as well as the fact that those autoimmune diseases are the same disease process. When we get down to enzyme deficiencies, again, this is that problem with I have a cup of coffee with cream in the morning and I have gastric distress, is that a lactose deficiency in the dairy product? Is it a salicylate deficiency? You have an issue with the caffeine. So it's very hard when you have combined foods or combination foods to break something apart and give it the cause of your problem. Then you have your non-IgE mediated food hypersensitivity. This is what used to be called the type 2 IgG delayed reaction. What we're finding, and what NIH has found, and I believe it's the European Allergy Association, that while IgG, by definition, 6 weeks or so, will give you a delayed reaction, the higher the IgG level was in your blood, it correlated with exposure to that food. It didn't quite correlate with the symptomatology that your patient would be complaining about eating that food. So that was a very interesting part. Again, next one, reaction to chemicals in the food, salicylate, citrus, and then chronic activation of the innate immune system, and that's where the OutCat test comes in. The many faces of food sensitivity. Most of what we see are going to be these top four things in the GI tract: irritable bowel syndrome, and it can be of the diarrheal or of the constipatory type, bloating, reflux, and associated malabsorption and/or nutrient deficiencies. A lot of this, GI-wise, is due to either gluten or dairy because of things we've done to them over the years. And you'll see another slide later on where it actually shows that because those two items actually are opioid peptides, there's another whole thing that occurs with that. Primarily that you want to eat more of it, and because gluten has a higher glycemic index than even a Mars bar, 2 pieces of whole wheat bread has a higher glycemic index than a Mars bar. You can indeed get fat, raise your blood sugar, get fat, not use it, get insulin resistance just by eating a standard American diet. Dermatologically, now this again also works through the GI tract. When we find that certain eczema, psoriasis, rashes, urticaria are again secondary to certain foods that you have intolerances or sensitivities to, and gets into the bloodstream and the body goes to attack it. This is going to be more for those people who had a very sterile environment growing up. You're not going to find eczema, atopic diseases, asthma, Crohn's disease in many people whose children lived on farms growing up and played with the ducks and the chickens and the pigs and the horses and ate their pound of dirt so that the mycobacterium in the dirt actually helped to mature their immune system. Neurologically, migraines, one of the most common symptoms we find with food sensitivity is migraine headaches, some chronic fatigue neuropathy, ADHD. We do get most of those kids and autistic kids off of gluten. There actually is it seems, a subset of autistic children, about 20%, who, if you take them off of gluten, there will be some immediate improvement within a week or so. So it's probably good and sound advice to have the autistic kids off of the gluten products. And then down at the bottom, respiratory, classic chronic cough, wheezing, airway constriction, and sinusitis. Also, thyroid disease. This is one of the reasons why when we're doing a full lab workup, and patients will come to you and say, well, my doctor did all my blood work. Yes, they do a CBC, a complete metabolic panel, and they may actually even do a TSH and a T4. But we do find that we're missing the pre-T3, the reverse T3, and something that I find probably in 30% of patients, the thyroid peroxidase antibodies are markedly elevated. And because of cross-reactivity, molecular mimicry, when I see a patient who has a TPO, thyroid peroxidase antibody, that is 2, 3, 4, 5 times higher than the upper limit of normal, according to whatever the reference lab using, if you take them immediately off of all gluten, within 6 to 8 weeks, when you recheck that, you're going to find a massive decrease in that level of TPO. And maybe you just saved somebody from being given the diagnosis of Hashimoto's thyroiditis. Also, we'll find infertility, irregularity in menses, and again, the weight gain and some weight loss and obesity. Musculoskeletal-wise, we're looking at the vague stiff joints, nothing that is diagnosable immediately as a rheumatoid or a rheumatic arthritis or an inflammatory arthritis. And immune system, you will find people who are getting more colds. Their adrenal glands are getting a little bit weaker, and they are being set up for autoimmune disease, going from tolerance to a certain food to intolerance to a certain food or foods, and then actual autoimmune disease. It is multifactorial. You will need that genetic predisposition. Probably 15 to 25% of what we're seeing genetically is that genetic predisposition. Good news is 75 to 85% means it's something that you have control over. Gut wall integrity, we spoke about that. Leaky gut, otherwise known as abnormally increased intestinal permeability. Level of stress. The studies they did on recruits, I believe they were SEALs actually, and medical students, where increased stress and cortisol levels will actually increase if you're under stress for a short period of time, increasing the protection that you get from secretory IgA antibodies and the mucus layer that it puts down. But after about a week or two of that same level of stress, the SIgA antibodies, the protective mucus layer that was keeping those dietary antigens from direct contact with APC cells is gone. And suddenly you have a gut at risk, that protective layer is gone, and those partially digested food particles can then get through and abnormally increase intestinal permeability, permeable intestinal wall, and you begin to chronically activate your immune system and start the immune process going on. We know that food intolerance reactivity is delayed anywhere up to 92 hours, from 1 day to 4 days. The example of difficulty pinpointing a trigger, for example, your morning coffee, is it the caffeine, is it the salicylate? If it's the milk, is it the whey or the casein or the lactose? All the studies that we've seen published to date that report specific intolerances by questionnaires, we find are unreliable. And the likelihood of pinpointing what's the right food that you shouldn't eat is down the drain a bit. Why is this happening to us now? For all these reasons. Too many of our foods have become advances in food technology, food scientists. There's an old saying, if you allow men in white lab jackets, well, men and women in white lab jackets, to tell you what to eat, then you're going to find men and women in lab jackets that are going to be doing the surgery and telling you what medications to take because of the food you've been eating. Our food scientists found back in the 70s that gluten, when you ate it, made you want to eat more gluten, and at that point, it became in almost everything, whether it was ketchup, mustard, soy sauce, Twizzlers, anything you could find gluten. Preserving and processing, irradiating different flavors, the food dyes, antibiotics, pesticides, all these things that were put into the foods to increase shelf life, increase color, taste. All these things are having effects on our system. GMO food now exposing us to never before seen proteins. One of the British journals came out 2-3 weeks ago and said that they have seen a rise in corn allergies since the GMO corn came over to the British shores by a jump of 50%. A jump of 50%. That's a problem, and we are part of it. It is true that you are what you eat, digest, absorb, and excrete. The combination of our highly susceptible immune system in the gut, chronic exposure to dietary antigens, both real food and junk food. I think it's funny, I saw one of those signs the other day that said, eat organic food. It's what our grandparents used to call food. And let's not call it junk food because it's just junk. And the combination of all these things are indeed opening the door to the chronic degenerative diseases that we see are matching the levels of these foods that we are eating. And here's the ugly foods, the top 10 genetically modified. Interesting that the top 5 foods that we are sensitive to are wheat, dairy, corn, soy, and peanuts. And wheat, dairy, corn, soy here are 4 of the top 10 modified foods that we're eating. Interesting also that the corn root worm that the GMO modification was supposed to outwit, that pest has now outwitted the genetic modification. And so instead of less pesticides being used on our corn crops, we now have 24% more being used in the last year because the pest has gotten through. They've also found the bacteria that they used for the genetic modification that Monsanto had promised would not get into humans. They found it in 90% of pregnant women and 50% of the babies. So We'll let that one go a little bit. And rice now we see is being polluted with the groundwater of arsenic and the potatoes. Well, the potatoes, this is another picture. Next one, the GMO difference. These are photos and these are the histological slides of rats fed genetically modified potatoes showing massive proliferative growth in the lining of their stomach and their intestinal wall. But I think the most obvious is you see that they're carrying these they're carrying tumors around with them from the food that we've been giving them. What we've mentioned before, that both wheat and dairy have been identified as being opioid peptides, glutamine, morphine, and casein morphine, and that when they cross the blood-brain barrier, they are causing an obsessive eating of more of themselves. So you're actually having a craving that you want that pizza and beer. Granted, pizza and beer may be one of the saving graces of Western civilization for the moment when you eat it, but it's actually not really great for you. So, and remember that recombinant bovine growth hormone that we're putting into our cows so we can get 40 times the amount of milk from their udders is only one amino acid away from the 192 of human growth hormone. Normal digestion, we understand that when we have food coming from the stomach, the enzymes in the pancreas will start to break most of the food down, and we will then absorb that into the bloodstream to fuel our tissues. This is normal. What's not normal is that when you have, for instance, and this is from the Scientific American article from Dr. Alessio Pisano describing celiac disease and autoimmune disease, where even that small amount of an indigestible fragment of gluten will induce the enterocytes in the gut to release the zonulin protein, and that will loosen the tight junctions, and that's only one cell thick between tight junction and bloodstream. The gluten fragments will cross over. They will line the enterocytes, induce those same enterocytes that secrete interleukin 15, and that's going to arouse the intraepithelial lymphocytes against the enterocytes. When the GI doctors do an endoscopy, and they take a sample of the duodenum to check for loss of villi and therefore give you a diagnosis of celiac disease, when they say that there's no destruction to the villi, if you look at the slide and see crowded lamina filled with intraepithelial lymphocytes, you are basically 2 steps away from them breaking free and getting the antigen-presenting cells of the immune system, joining that modified gluten tissue transglutaminase, which is what we test for, which is released by the damaged cells, again, modifies gluten more. You are going to kill those villi. And that's what's happening here in this photograph. It's not a photograph, sorry, in this cartoon. So what do you do when you see that? You may know the 4R program removing the offending agents. In this case, it would be food, if we're talking about gluten. If it is certain bacteria that we know are associated with certain disease states. I know that if I have a patient who has chronic low back pain and they're coming back with the diagnosis from the orthopod or from the chiropractor after diagnostics are done of ankylosing spondylitis, I know I have a greater risk of doing a stool exam of finding Klebsiella pneumonia. I know that if I have a diagnosed patient with rheumatoid arthritis and I do that stool exam, I'm going to, more likely than not, have Proteus species in there or in their urine or a Stitchobacter species or, again, Klebsiella species. So when you have these chronic degenerative issues, again, in the gut, you have to remove the offending agent or agents, whether it's food or bacteria or candida or viruses. You're going to replace missing enzymes, whether they're salivary enzymes, pancreatic enzymes, hydrochloric acid, etc. You have to replace that. Reinoculate back the right probiotics with some prebiotics. There is a caveat here. You really should find a balanced probiotic that has Lactobacillus bifidobacter, some Streptomyces, hopefully some Saccharomyces boulardii, which will also increase SIGA and keep the probiotics you're putting into the gut, keep them there a little bit longer. They will only stay on average about 13 days before they have to be replaced again. I don't think I would recommend that you only give it every 13 days because you do need the probiotic on a daily basis for vitamin production, absorption, mucus production, a host of other things. And then repair the lining of the gut. Again, you do that after you remove the offending agent. You're using, whether it's glutamine, curcumin. There are some medical foods that you can take in a shake that will do that for you. Meditation actually helps repair that by decreasing stress cortisols also. I'm going to do a case study of somebody that was classic in what we're talking about. This is someone I knew for 3 years. I'm also born and raised in Philadelphia, who came from University of Miami, the Department of Rheumatology, because she had a diagnosis of an inflammatory rheumatoid arthritis for a year and a half, and her joint pain was just getting worse and worse no matter what meds she was taking. She was getting increasingly fatigued, irritable, her weight was going up, and she was clinically depressed. She was on, at that time, methylprednisolone, methotrexate, and Humira, and had recently stopped prednisone, Adderall, Clonopin, Tramadol, and Tylenol number 3. Quite a bit of meds. She did have a moon face, a buffalo hump. There was facial acne and chest and back acne. She was osteopenic, everything that you would expect from being on certain meds for an extended period of time. She was a consultant for medical care facilities so she could get the best medical advice she could, but it was just more of the same. It was another drug for her to take. She had good habits, didn't smoke or drink. Her diet was standard American. She tried to exercise 3 times a week, but pain stopped her. Family history there is below, nothing that would give you a rheumatoid history. She was 5'4" and 170 pounds. Blood pressure was normal, pulse normal, respirations were normal. She did have a positive Arroyo sign bilaterally. For those of you who don't know what that is, this comes from the great flu epidemic after World War I, where Dr. Arroyo found that those people who had had the flu and survived, remember 20 million people out of 1 billion in the world died, those people who had it and survived were exhausted. And the one thing they all had in common was that he found that their pupillary meiosis was not there. He would shine bright light in their eye in a darkened room, and if the meiosis occurred, it would not be held. It would actually look like it was pulsating, open and close again, or it never closed. And that is sympathetic and under control of the adrenal glands. Her tongue was dry, coated, like she had some yeast in there, heavily scalloped on the periphery, on the edging, because her tongue was a little bit swollen, a little bit too big for her mouth, and what we were finding was the impression of the teeth on the outside of the tongue. Now, classically, you're going to get that if you have myxedema, but then you talk like this with a swollen tongue. The only other time you're going to see a heavily scalloped edging or periphery on the tongue, or see any scalloping, is with multiple food sensitivities. She also had sublingual stippling. Sublingual stippling is when you're looking under the tongue and you see those magenta, purple, dark spots, or what looks like a blood vessel that broke and healed. You can also see some tortuous, dark red, purple lines under the tongue. You'll see this in older people. What it is representative of is heavy metal toxins stored in the body. This may not be found if you do a heavy metal whole blood test. That's just a snapshot and will show you what's circulating in the blood. This more is showing you what is already stored in the tissues, whether it's kidney, pancreas, brain, heart, muscles, or bone. She had a 1/6 systolic ejection murmur. She had gross hyperkeratosis follicularis, so she had some essential fatty acid deficiency, and then she had the swelling at the base of her thumbs, wrists, etc. Markedly decreased grip strength and pain below pressure of her sternum, and anterior tibia. The bone density showed osteopenia of both central and peripheral skeleton. She had other labs. The ones I'm putting up here were classic in that her vitamin D was a little bit more than 20. Her rheumatoid factor was not huge. It was 8.7. I don't know if you can read this bone scan. It's about 11 lines showing that there's areas of increased uptake, and there's a question by Dr. Desai, the radiologist, whether this patient has a systemic inflammatory arthritis, because there's uptake in wrists and thumbs and her distal joints, metaphalangeal joints, just everywhere. 11 lines describing her uptake. So I'm working on the diagnosis now of an inflammatory arthritis, not rheumatoid per se. Adrenal fatigue, multiple food sensitivity, EFA deficiency, heavy metal toxins turned out to be mercury and arsenic, and at dysbiosis, she had digestive enzyme deficiency. We put her on no wheat, dairy, and corn initially, liquid fish oils, orthobiotic, probiotic, digestive enzyme, K-Prex for pain, and vitamin D 5,000 units every day. We did a national lab IgG test that showed no food sensitivities, and then we arranged for her to have the outcast test, which showed these severe intolerances. Interesting that it was actually for the whole week, not just for gluten-gluten. And she followed everything she had to do. She had a lot of business stress physically. She's never felt better. Her joint pain was down to a 4. She began the supplementation for her adrenal fatigue, fine-tuned her other vitamins and minerals, and, but primarily she was going to identify those food intolerances and avoid them. This is 1 year later, and the impression is from her bone scan, an unremarkable study. Saw her last July, and she looked marvelous, and she thinks she looks marvelous. The only thing she could talk about was that she had fit into a size 4 little black cocktail dress of her 21-year-old daughters. She had no pain except for mild burning bilaterally in her hips, but that was on extended exercise. She was able to work out 3 times the amount she was working out before, or spending the morning in her garden, and she was on no medications. She lost about 37 pounds just by avoiding those foods. So understand that balance is everything. There's a constant state of this chronic inflammation in the GI tract to keep us tolerant. That's essential for our immune systems to mature, hopefully by the age of 2 years old, and also to develop the normal morphology of the mucosa. Secondary to that hygiene hypothesis, where when we lived on farms or kids played in the dirt, they actually were healthier. Today, with clean hands and refrigeration and sterile foods, and we've lost the fermented foods we used to eat a lot of, increased antibiotics, vaccinations, etc. We're seeing more atopy. The children who are too clean are more likely to develop the atopic illnesses, Th1 immunity, whereas vaccinations are stimulating Th2, and we're getting this modern sanitized, vaccinated child who's getting these Th2 issues. Crohn's disease was first noticed in the Upper East Side of New York about a little bit more than 100 years ago on those children who had their nannies and were not allowed to get dirty. So let's tie it all in. This is from Alessio Fasano, finding differences in levels of leaky gut and expression of the genes regulating the immune response in the gut mucosa. It was different. People who were raised one way were less likely to have certain diseases. Chronic inflammatory disease of the intestine, characterized by the leaky intestinal gut, and then unwanted antigens that get into our bloodstream and lead to the systemic inflammatory response syndrome. Whether it crosses your blood-brain barrier, whether it attacks your kidney and chooses to form immune complexes under your skin, on your nose, and we call that systemic lupus, or it's in your joints. What we're finding, and this is apropos to the AMA and diabetes, that in most obese patients, that obesity is associated with a low-grade inflammation in the fat, visceral adipose tissue. In fact, as of last May, with some fat studies, they found 16 known inflammatory biomarkers in the fat, that we are indeed carrying our own seeds of our destruction with interleukin 1 and interleukin 17 and tumor necrosis factor alpha and nuclear factor kappa B. And as Michael Pollan says, you are what you eat eats. Instead of our cows eating the grass they are meant to, we're forcing grains down them to fatten them up. And then we have to give the antibiotics to kill the normal bacteria in their gut so that they don't make so much gas that their stomachs explode. Farm-raised salmon, instead of plankton, we're feeding them soy, and then they're living in runoff water that has toxicants in it. And then the high consumption of the omega-6 fats. We focus on the gut because 70% of all of us here in this country have some gut symptom or disease. It's the most sensitive to insults. It also is where the majority of our immune system is, and the most and best clinical outcomes across all the disease spectrums result, at least when we normalize the gut. We always try to begin with the gut. Food and other exposures interact with our genes in either positive or negative way. We're all unique. I have been using the OutCat test because of its innate immune system response, and diet and lifestyle modification improves general health. We know that. But what we haven't gotten into was that so far much of it is what we do, what we eat, what we exercise. So thank you. Now I guess we're going to look at some questions.
Yes, Dr. Blyweiss, we do have a question, but first I want to remind everybody that if you do have some questions, please write them in the question box of your GoToWebinar panel, and we will address them right now if you like. The first question comes from June, and she asks why wheat is not on the list of the top 10 GMO foods.
Because they don't count it as genetically modified. They count it as scientifically engineered by Nobel Prize winner to save the famine-ridden population of Pakistan and India back in the late 50s, early 60s. I don't know why. I think it should also be called genetically modified. I think it's just words, June. Genetically modified or scientifically engineered. What he did more was pick and choose certain other wheat grains and force them to hybridize. He didn't actually take them into a laboratory and use a virus or a bacterium to add something to them. So there's something to the fact that it was scientifically engineered through horticultural hybridization, although that was a forced issue.
Well, perfect. Well, it looks like we don't have any more questions for right now. So I do want to remind everybody that this is a preview of the Gut Brain Symposium in Los Angeles on August 16th through 17th at the JW Marriott at LA Live. If you have any questions about this event, please call the American. Oh, looks like we do have one more question. But again, if you do have any more, questions about this event, call the American Academy of Anti-Aging Medicine at 561-997-0112. I'm going to address this last question here for a second.
And also, Dan, there is a code that people listening tonight or attending tonight can give to you, and I believe it's a lot of money off the.
Yes.
The
If you do mention this event, thank you, Dr. Blyweiss. If you do mention this event, we will give you a very significant discount to attending that event. So please call us, and we will take good care of you. So I do have a question from Jane, and she writes, for a patient off of gluten and wanting to test with an ALCAT test, how long do they need to eat wheat for in order to get an accurate test?
Well, that's a great question. We have that same issue when people are off of wheat because they feel better being off of wheat, and we want to test them for tissue transglutaminase or deamidated gliadin peptides. Classically, somebody would have to be back eating wheat for antibodies at least 6 weeks to 8 weeks. But you can still see results with an OutCat test if you've been off of wheat. You can still see results because that's your innate immune system. That is not that is not correlated with exposure to it. Now, it may be a mild response, but you should still have a response to that.
Perfect. So I did just get two more questions, both of the same one, pretty much. We will be sending this presentation out tomorrow or the next day, or Friday. So you will be getting a copy of this. Everybody who attended, registered didn't even show up, will get a copy of this. So please don't worry if you miss a portion of this. So again, this is a preview of the Gut Brain Symposium. If you have any questions, don't hesitate to contact the American Academy of Anti-Aging Medicine. We'll get you registered for the event. And Dr. Blyweiss, thank you. I appreciate your time for doing this.
Sure. I hope to see these people there. Remember, it's Alessio Fasano himself, as well as William Davis, who wrote Wheat Belly. David Perlmutter, who's a neurologist who works with gut-brain issues, and a cardiologist also on using gluten or eating gluten as a problem cardiologically. Thank you, Dan.
Absolutely. Thanks, Dr. Blyweiss. See you there.
All right. Ciao. Bye-bye.